Oh no! It looks like Abby has norovirus. Norovirus, also known as Norwalk virus, is not enveloped. It's positive since single-stranded RNA, mesophilic, and it's icosahedral-shaped virus. For the early localized infection, symptoms begin 12 to 48 hours after exposure. These include nausea, vomiting, abdominal cramps, and diarrhea, often accompanied by a low-grade fever, headache, and muscle aches. This stage lasts 1 to 3 days. Oh, wow. In the early disseminated infection, the infection spreads to the intestines, causing dehydration due to fluid loss from diarrhea and vomiting. Symptoms may worsen, leading to weakness, dehydration, lightheadedness, and a potential drop in blood pressure. In the late persistent infection, most people recover in 1 to 3 days, but some may experience ongoing fatigue or discomfort. Long-term complications are rare, but severe dehydration or complications in vulnerable populations can occur.
Norovirus is a pathogen that is most commonly transmitted via the oral fecal route. Contaminated surfaces, food, and drink are common routes in which norovirus is ingested. In addition, crowded spaces breed the spread of norovirus because close contact with an infected individual is a risk factor as well. According to long-held belief, norovirus remains isolated within the GI tract, most severely affecting the small intestines. However, recent studies have suggested that perhaps this pathogen can spread to peripheral tissues. Cellular abnormalities such as enlarged and pale mitochondria present in an infected individual's intestinal tract, along with delayed gastric emptying and the potential apoptosis of enterocytes, could all contribute to the diarrhea and vomiting that is so trademark of norovirus, considering that these alterations negatively affect digestion. Virulence factors include norovirus's ability to limit cytokine induction via the VF1 protein and to suppress host cell antigen presentation by utilizing the VP2 protein. The VF1 protein inhibits the innate immune response, whereas the VP2 protein inhibits the adaptive immune response. Without host cells presenting antigens for identification, the adaptive immune response cannot be activated and norovirus can go undetected in the body. Finally, norovirus is capable of establishing itself persistently within the intestinal tract.
Each year, norovirus causes approximately 19 to 21 million illnesses, 2,500 outbreaks, 2.3 million clinical visits, 109,000 hospitalizations, and 900 deaths. Death caused by norovirus is primarily seen in patients 65 and older. The reservoir of infection, or the pathogen's natural habitat, is humans. Its portal of exit, or sites from which an infectious agent leaves the host, is to find a new host is the digestive tract via vomiting and defecating. Norovirus is horizontally transmitted via the fecal-oral route, and it can be spread directly or indirectly through humans. Someone can be infected directly through physical contact with another human who is carrying the virus, or can be infected indirectly by coming into contact with fomites or contaminated surfaces, food, or water. The portal of entry, or how the pathogen enters the host, is by mouth, and norovirus will enter a susceptible host.
Currently, there are no antimicrobials that are able to effectively eliminate norovirus or even reduce the number of viruses. There have been some experiments done using broad-spectrum antiviral medications that inhibit viral RNA replication, but it's not an approved treatment. To reduce or eliminate the virus, practicing regular hand washing is important, especially after using the bathroom. While norovirus is resistant to most common disinfectants, disinfection of contaminated surfaces with bleach cleaners have been proven to help reduce the spread. Additionally, if someone has the virus, isolating and staying away from people until symptoms subside is a safe practice to reduce the spread. There is currently no vaccine for norovirus. However, there are inactivated subunit vaccines in the process of being developed. These use empty capsid proteins that mimic norovirus to stimulate an immune response without actually causing an infection. Human behaviors that reduce the transmission are frequent hand washing with soap and warm water, avoiding contact with infected individuals, isolating from people if you are infected, and disinfecting contaminated surfaces regularly with bleach-based cleaners.
My norovirus is gone! I feel so much better!